Emergency department visits have been increasing for the past decade in Ontario. Overcrowding of emergency departments contributes to longer wait times for patients, and especially when that demand for services outweighs their ability to supply timely care. Little is known if this increased demand for emergency departments extends to paramedic services, or if paramedic transports, that is, when patients call for 911 services, could be contributing to this emergency department overcrowding. High usage of paramedic services has been documented and reported during the COVID-19 pandemic, but little is known if this is a new phenomenon or one that has only been exacerbated by the pandemic. So our objective was to examine changes in paramedic transports over the 10 years prior to COVID-19 and compare these to increases in population growth and emergency department visits by walk-in. We conducted a retrospective study of Ontario using population-level ICIS administrative data. We analyzed all emergency department visits from 2010 to 2019 for patients aged 18 years or older and who arrived by either paramedic transport after calling for 911 or by walking in themselves. We examined changes in incident rates in sex, age, condition severity, geographic location, comorbidities, as well as we looked at the outcome of the ED visit. Using a statistic called rate ratios, we were able to examine the magnitude of difference in changes of emergency department visits and how they increased per 100,000 Ontarians. In our research, we found that there is a crude increase of 38% for patients transported by paramedics. In comparison, Ontario's population only grew over that time by 9%, and on ED visits by walk-in only grew by 13%. After adjusting for this population growth, rates of emergency department transports by paramedics per 100,000 Ontarians increased by 26% compared to ED visits by walk-in by only 3%. This suggests to us that overall, rates of paramedic transports have increased across all patient characteristics and measured in the study and throughout the entire province. These findings indicate to us that these increases in paramedic transports have far outweighed and outpaced population growth and ED visit walk-ins. Contrary to conceptual views of paramedics and 911 utilization as an emergency service, the majority of these transports are for non-emergent medical reasons, suggesting that patients are using 911 and paramedics as a means to access healthcare and not necessarily for emergency care. What we observed is that increases in paramedic transport rates were not bound to urbanized regions or specific zones, but were province-wide across all of Ontario. As Ontario's population continues to move into an older age demographic, paramedic usage and transports are likely to continue growing at this significant rate. What our research points to is that there is now a mounting need to develop innovative solutions to meet this increased demand for paramedic services, 911 utilization, and overall ED visits, and to implement long-term strategies across the entire province around paramedic systems. Paramedicine should cultivate new care models to incorporate more primary care integration with a focus on older adults. This means that referrals could be made in the community so that some patients may not be required to be transported, thereby reducing the burden on our emergency departments. Or alternatively, transporting these patients to non-emergency department healthcare center alternatives when safe to do so. Similar to staffing shortages that we've been observing in the emergency departments, paramedic services may also be facing these same staffing challenges as demand increases. With growth in the paramedic scope and skill set, expanding paramedic training to universities could be a prudent strategy to attract new students that are adept for a new scope of practice and prepare for the field for the future.